While it's common to hear your dog gag or dry heave occasionally, it may indicate a serious health issue. It's a disturbing sound to hear and most certainly begs the question, why does my dog keep gagging? From kennel cough to intestinal parasites and heart disease, this behavior is never an indicator of anything good and may be caused by a variety of health problems, some more serious than others. Let's take a look at the reasons your dog may be gagging and dry heaving. Generally, gagging is a common and normal reflex for dogs. It's usually a prelude to vomiting. So if your dog occasionally gags and vomits soon afterwards, there is usually nothing to worry about. Your dog probably just had an upset stomach. This is more common in older dogs who produce more mucus and as a result are more prone to gagging and vomiting. Dogs who drink or eat quickly and in large quantities will often gag immediately following their meal. Again, this is normal and does not indicate a serious threat or health issue. However, chronic or non-stop gagging is a cause for concern. If you've been observing this, your dog probably requires veterinary attention. Let's talk about some reasons your dog may be constantly gagging. It's possible your dog may have a foreign object lodged in their throat or esophagus and you don't even know it. In this situation, there's very little you'll be able to do to help them. Small objects like sticks and even stones can get stuck in the back of your dog's throat quite easily. It's important that you closely monitor your dog when they're playing outside and discourage chewing on random objects that aren't play toys. Another common reason a dog may be constantly gagging is kennel cough. If you notice your dog hacking away and constantly making choking sounds, they may have a case of bordetella or kennel cough. This disease is highly transmissible and easily passed from one dog to another. An infection results in the inflammation of the larynx and trachea. An infected dog will have a persistent, forceful cough followed by continuous gagging. The coughing and gagging will become worse as the disease runs its course. Symptoms may also include sneezing, eye discharge, and a runny nose. In this situation, it's always recommended to visit a veterinarian who will prescribe medication to alleviate your dog's symptoms. Luckily, kennel cough is not usually fatal. Sinus and nasal infections are also common causes for an unrelenting cough and gagging. The postnasal drip from infections like sinusitis and rhinitis may be responsible for constant gagging in your dog. Infected teeth and problems with nasal passages and sinuses are common causes of these infections. Again, medications will help your dog fight off these symptoms, so be sure to see your vet. In senior dogs, a problem that may cause constant gagging is heart disease. Chronic gagging accompanied by rapid breathing, lethargy, and a bluish tint on the tongue may be signs that your dog is suffering from cardiovascular disease. If your dog is exhibiting these symptoms, it's crucial to seek medical attention as soon as possible. Intestinal parasites are unfortunately more common in dogs than you might think, and chronic gagging may indicate that your dog has a roundworm infestation. This is because the roundworm larvae migrate into a dog's lungs. Once there, they move through the capillaries and into the air sacs, causing your dog to constantly gag. Regular deworming is recommended to prevent a roundworm infection. In smaller dog breeds like Chihuahua or Yorkshire Terrier, tracheal collapse is a condition that may cause gagging and choking. A tracheal collapse may worsen over time and require surgical intervention. This may be a congenital condition, or your dog may simply acquire it at some point in their life. Now, what about dry heaving? Similar to chronic gagging or choking, you might be wondering what it means if your dog keeps dry heaving. You certainly know that dogs frequently vomit, usually when they eat too quickly or something irritates their stomach. If your dog occasionally vomits without displaying other symptoms, there is no need to worry. This is perfectly normal, and your dog will feel better shortly after vomiting. However, if your dog is always making vomiting motions and sounds without producing any vomit, this may be a serious problem. This is called dry heaving or retching, and dogs typically do this when they need to force something out of their stomach that's bothering them. This tends to occur suddenly without warning and may be alarming. As a dog owner, it's important to be able to identify the signs and causes so that you know how to provide relief. So, what are some common causes of dry heaving? The most common cause of dry heaving in dogs is nausea. Your dog may experience nausea from a variety of reasons, including infectious disease, intestinal parasites, pancreatitis, dietary discomfort, or other conditions that are known to affect gastrointestinal health. A mysterious condition that may cause dry heaving is bilious vomiting syndrome. For reasons that are not entirely understood, your dog's stomach may become empty long before their next scheduled meal, leading to discomfort. This causes your dog to dry heave and maybe even vomit up a small amount of fluid consisting of mucus and bile. You may notice this occurs most often in the early morning. If this occurs regularly, you can try feeding your dog later in the evening and again early in the morning. Dividing your dog's food into 3 evenly sized and spaced meals may help as well. The more regular the feeding schedule, the better. The next reason your dog may be dry heaving is one we're all too familiar with: bloating. Bloating can trigger a serious case of the dry heaves. When food and gases become trapped in your dog's stomach, it expands, and this expansion can cause the stomach to flip over on itself, cutting off blood supply to vital organs. This condition is extremely dangerous in dogs and requires urgent medical attention. Last and least likely, your dog may have a tumor obstructing their throat. For example, a cancerous growth in the throat will interfere with the dog's eating and breathing and will most often cause dry heaving. In order to stop the dry heaving, the growths will have to be surgically removed in this case. In regards to the topic, another popular question that comes up is, why does my dog keep choking on nothing? If your dog has developed a cough that includes a choking sound, your dog may have been infected with some sort of disease. This could be caused by kennel cough, pneumonia, heart disease, or reverse sneezing. You should observe your dog closely, and if it seems like they're choking on nothing, it may be time for a visit to the vet where they'll be able to properly diagnose the problem. At the end of the day, no one knows your dog better than you. A sudden change in dog's behavior may be cause for concern, as they are creatures of habit that don't normally deviate from their routine without good reason. Again, if you're concerned but unsure what to do, always consult with your vet for a professional opinion.